I had this incredible time getting to know Paulette the other day, and I'm just really honored to be in the same community with her. We are going to share just a little bit of her story, and my hope is that it not only encourages you, but also gives us even more hope for our world. So brief bio of Paulette, and now I'm in that kind of season where I have to extend my lead. Paulette is an advanced practice nurse who's a member of the pediatric hematology and oncology team of the Rutgers Medical Institute. And Paulette came to pediatric hematology and oncology from pediatric infectious disease, where she worked with women and children with HIV. Also, her experience includes pediatric critical care transport and emergency medicine. And Paulette completed her undergrad degree actually in education. And then she became nurse practitioner, and then we'll talk about her journey there. And she also has a master's degree in science, in nursing, and she specializes as a family nurse practitioner, and she got that degree from Pace University in 1997. And also, she has a master's degree in public health with a specialization in urban health education from City University of New York, Hunter College. She also has a Ph.D. In urban systems from the joint Ph.D. program at Rutgers University and New Jersey Institute of Technology with a specialization in urban health. And her clinical work focuses on pediatric cancers and blood disorders. And her research focused on the transition of young adults with sickle cell disease from pediatric to adult healthcare services, with the goal of developing and implementing a comprehensive transition program. And when I spoke with her, I remember Paulette saying, thank you, Paulette, that her retirement plan included getting that PhD so that she can teach the next generation. So welcome, Paulette.
Thank you. Thank you.
I want to start with just a little bit of a background of how you were brought up. So tell us a little bit about your childhood and how you chose nursing when you started out as an educator.
I was born in Jamaica. I'm born and raised. I'm the oldest of 5 children. My mom was the engine behind everything, as most moms are. And as a youngster, my goal was to be a politician. Because back then, your politician was your community leader. And I saw the fantastic work that they did. So I chose to go into education as an avenue in which to serve my community, and move forward into a higher office where I could make a difference in the lives of others. In 1980, my mom, at the age of 41 years old, was diagnosed with colon cancer and died just a few months after diagnosis. And I had no idea what cancer meant, what illness meant. I was a young teacher and had just applied to come to the United States to continue my education. So what Mom said to me, I did not know she was dying. I didn't expect her to die. But on the very morning that she died, we had a long talk. And her talk was, I am not the parent of my siblings. I should pursue my dreams. And in whatever I do in life, to always be that light and always bring others with me, never to go alone. Because as success means you're taking others with you. So I had no idea what to do. That afternoon at 6:20, she passed. And here I was now without a mom. I had no idea. But I kicked into gear. Okay, thank you. Okay. It kicked into gear that, oh, maybe I should explore something in healthcare because I didn't know, I didn't understand. How could this happen? The funeral happened, and 2 weeks after her funeral, I came to the United States to go to school. But in my head, education was still there, but I could not be the help. I just think she did not know, we did not understand what illness and death was and how quickly it can happen, and suffering, because she suffered. And my pastor, Episcopalian pastor, his wife was a nurse, and I wrote to her, and I told her the struggles I was going through. And she suggested to me to go to nursing school. In her letter, she said, nursing is the only profession that gives you the opportunity to be present at life and at the end of life, at the beginning of life and at the end of life. So I picked up the yellow pages. I had no idea what. I picked up the yellow pages and I scrolled to School of Nursing, and I made one call, and they said, oh, we have an open house tonight. So I went to the open house, and I got accepted to the nursing program, and there begins my profession of nursing. At Muhlenberg School of Nursing in Plainfield, here in New Jersey. Yeah.
Thank you, Paulette. And I hope nobody thinks that getting into nursing school is that easy. But it's so obvious that I think one thing that really struck me when I was having conversation with you that Haejin, death brings life.
Absolutely.
And I'd love for you to talk about that a little bit. And you know, you were brought up in a Christian home with a kind of faith that is just so unshakable, and I just so admire that about you. We want to know how your faith shaped your work, and this is no easy work.
No,
and caring for cancer patients. So tell us a little bit about what you meant by how death brings life and how your faith shapes your work.
Absolutely. I think I go back to the times when, when my mom was ill, when she got her diagnosis of colon cancer that was already metastasized. And the times of pain, she had so much pain. And reading the Psalms was her comfort. And she would say, I am not the only one who suffers. And she found so much comfort in the Psalms. And I remember hearing her pray, God, if death is the only way to relieve me of my pain, I am ready to die. And I would say, how could Mom pray to die? And she said, you have to have faith that there is a better place where there's no pain. And as a result, when she died, I felt that I had to carry on that light that she told me that I must shine. And I think I see through her faith in God made me stronger. And so each patient that I touch, each life that I touch, I just remember how important it was if she had had someone to explain to her what to expect. And I oftentimes tell my colleagues, if my mom hadn't died, you wouldn't have known me, because I would be a teacher, or I would be, I aspired to be a minister of education in Jamaica. And through her death, I am here today.
I think medical profession is one of those professions.
That's okay. It's okay.
And thank you for sharing about your mother.
Yeah.
That we need this profession because we live in a very broken world.
Yeah.
And we're hoping that in the New Jerusalem, we don't have the kind of pain and suffering, that we don't need the type of medical professional that will have to deal with the pain and suffering and death. But we are grateful that God has given us this gift of medical advancement. But I think even within the medical professionals or the work of medicine, there are a lot of brokenness. Mm-hmm. It's not perfect. And we have certain misunderstanding about what this profession is about. So as an example, I can speak about my own profession. As a legal professional, I hear people talk about lawyers doing a work of fixing things, right? You have a legal problem, you come, and then we do the transactional work of our clients' needs. But that is a very limited view of actually legal profession. What lawyers do is when you have a client that wants to do mergers and acquisition, marriage, adoption, and these kind of opportunities, lawyers come in, and what we do is actually help our client create new opportunities. And when our clients have problems, broken relationships, unfulfilled promises, that's where lawyers come in and mend that fracture so that our client can move into the new season of a new creation, new opportunities. So when we look at the legal profession from that perspective, it gets very exciting. And I bet there is certain, not only brokenness, but also misunderstanding, a lack thereof, that medical professions also hold. So can you talk about that a little bit and help us better understand what medicine is to us?
Yeah, I would say transition is a constant. And we are constantly moving from one space to the other, and from infancy, pregnancy, infancy, we move into the toddler stage, and childhood. So it's this constant, and in healthcare, it's the same. And I think part of what is not understood or accepted as much is the fact that we don't accept our various transitions, that it should happen. We are afraid to move, especially as we get older. We move from one space to the other, and sometimes they're so subtle. So for me, who work with people who are getting life-altering diagnoses, a parent the child has a fever, you take your child to the doctor, they get blood work done, and it's leukemia. So there, in that setting, that transition, you go through grief, because everything was fine yesterday until the child had a fever. But one of the most important things is that hope. And what is hope? And we have to navigate all this with grace. And what is grace from a healthcare perspective? It's empathy and understanding. Understanding and meeting that person where they are. And I think that's one of the things in healthcare that is not very well explained or understood, that these transitions occur, and what role can we play? How can we make it easier for others?
So you have been invited into this work by the Almighty God, and you have accepted this invitation. And I want to know more, maybe specifically as an example, how you invite God into your work. Because a lot of times I think we ask for the vision, right? Ask for calling, like, what am I meant to do with my life? And then, of course, some of us are very fortunate to hear God's voice of leading us to certain professions, certain calling, and then we get so excited, and then we forget about God. We forget to include Him in our work. So how do you invite God back into your work every day?
I think God is in my work every day. As when I wake up in the mornings, I pray before I leave home. When I go to work, oftentimes you have challenges, and one of my practices, I go in the bathroom, I look in the mirror, and it says, it's not about you. So that's one of the ways that I deal when I have a really tough a challenge. I always make it to the bathroom and says, it's not about you. You have to meet that person where they are. And oftentimes, you have some families who they just don't understand. It's difficult to understand what is going on. And it's to meet them where they are, not where you think they should be. And sometimes it takes time. When you have a child or a family member, or even yourself with an illness that is just absolutely life-altering, you cannot see how you're going to survive, how your family is going to manage, how am I going to maneuver work with a sick child in the hospital. You don't want to hear what others have to say. Sometimes there's a degree of denial. How could this happen to me? Even with a simple diagnosis, you go through those stages of grief because it's something different. You're making a transition. There's something occurring in your life. So when I walk, I think spiritual health is just as important as physical health. So when I walk into a patient's room, a patient who may be dying or who the chemotherapy has failed and there's nothing left, my question is sometimes, what do you hope for today? One day at a time. I have a song that I play, I listen to, I give my patients to listen, because sometimes you worry about what's going to happen next week. If we live one day at a time, yesterday is gone, tomorrow is not promised, and just live for that day. What do you hope for today? Sometimes it's just that my child has no pain, or that my child gets some sleep, or I don't know. He said, think about it. We have to have one hope. And there's a whiteboard in each patient's room. Please put your hope, the one thing that you hope to accomplish today, on that whiteboard. And together we will see that it happens. So in every way, or one of the other things for me is asking the family, not everyone is a Christian, asking the family, do you believe? Do you have faith? Who do you lean on? May I call the chaplain? Do you want someone to pray with you? Those are questions that a lot of people are uncomfortable to ask. For me, seeing the way my mom leaned on God, it's my responsibility to ask. And I try in every way to make that happen.
I think you briefly told me about the difference between the adult patients and the children who are suffering from cancer. Can you tell us a little bit of an insight, the inside look into their life that we may not be privy to?
Yeah. So for me, working with a pediatric population, it is just a wonderful. Each day they make you stronger. They teach you life lessons. One thing that I see, especially with teenagers, when they have a diagnosis that, okay, the chemotherapy is not going to work anymore, it's comfort care, making the transition from no longer cure, palliative care, comfort care. They kick right into gear and start the planning process. How do I want my funeral? What do I want to wear? And they so easily, I am yet to understand how accepting they are of making that move. And over and over and over, through the years, I see this where, okay, now there's no more, this is what I want. I want to wear this baseball cap. I want this, I had one young lady who told me what she wanted. I said, you have to tell your mom. But she kept telling me what she wanted. And in the end, she had a bone marrow transplant at another institution. My husband and I were there with her on that night until the early morning, and then shortly after we left, she passed. And the one thing she wanted was never to have an open casket, but that's what her mom wanted, to have an open casket. And so how as a healthcare provider, you tell a mom, that's not what she wanted. And then her godmother called me. The very first time I totally broke down and cried when the godmother called me and said, the casket has to be closed because her body, it looks so bad. And I totally broke down because I know her wish came true. So with young people, there's so much to learn that I have learned from them, how to navigate and how to take life's journey as just a journey. And along the way, the people that we meet, to share what we can with them. And when the end comes, to prepare the others, because it makes it so much easier when we can prepare others that we are making an exit and we're leaving work for them to do. Because that's what my mom did to me, and I see the kids do that to me. They continually do, renew that. There's still work to be done.
I think the kind of care and the stewardship that you show to the patients also teach them to be the kind of caretaker and stewards, even as patients, because they understand the relationship, the community that they are in during this time of transition. So you do a lot of direct care, and I think it's, I can imagine how exhausting that can be, to really care for each patient in a very personal level. But at the same time, you do this larger policy work. I don't know how you have time for all of this, but you are on the advisory board for the New Jersey State for pediatric care. Can you tell us a little bit about that and why you're involved in that?
I think a lot of policies that are made by people who have no idea what it is like on the ground. So in order to be effective, I think the best thing is to have people whose hands are wet sitting at that table. And so, luckily in the state of New Jersey, we have a cancer network, and there's a pediatric advisory board, and on the pediatric advisory board are clinicians as well as state legislative workers. But if we who are providing the care are not there, they don't know, they just assume. So it's so important for us as a community to really sit at the table where decisions are made that affect the lives of people, because that's the only way we can continue to show love and caring, understanding, and it is effective.
On this personal level, individual daily work that you have with your patients and the policy work that you're doing, in addition to that, you are doing this global work. Tell us about that.
Yeah. I have been a member of the Organization for International Development for over 28 years. It has been in existence for 34 years. And what we do as an organization, we travel to the Caribbean, we've been to Brazil, and we choose one country in Africa each year where we go on medical mission to serve the underserved population. In Jamaica, we have a mobile health van, and our mobile health van, we have dentists, ophthalmologists, a group of people from New York and the metropolitan area. And then we just go, we organize through the clinics, and we just give care hundreds of people every day for a week or two. Organization for International Development, this last year, we decided that we would buy a mobile health van because, for mammograms, because in Jamaica, the #1 cause of death for women is breast cancer. And most women who are diagnosed with breast cancer between the ages of 33 and 45 are presenting with stage 3 and 4 cancer. So that is the our big push. In 2025, we will not do any missions overseas because we're focused on getting this mammography bus down there, and so that we can screen women, education. Part of my job is to develop the education program and have mammography be available to those who cannot afford it.
And I know that a screening like that, mammography like that, and on-the-ground support, medical support like that actually leads to prevention of orphans, prevention of trafficking, because kids get very vulnerable without moms.
Mm-hmm.
It leads to community development
Mm-hmm.
of a healthier country.
Mm-hmm.
So I am so appreciative of what you are doing, your organization's doing, your colleagues are doing to really not only have a direct impact on a young woman, but also to really foster healthy community and
Mm-hmm.
families. So I'm really moved by that work. We would love to get into a Q&A session for a few minutes, and then I have one more question at the end that will conclude this time. So, if you have any questions.
Number one, thank you. As an aid work, much of what you're discussing is immediately relevant. Let me just put it that way. Two questions. About you. How do you, I have read that, and I've seen examples of givers, such as yourself, suffering from compassion fatigue. Is that something that you've had to deal with?
I've had patients who have passed that I've been very close to, that I have someone that I talk to when they pass. I, but every, I love what I do. I really, really love what I do. Have had patients, for example, recently I had a patient who is not eating. Mom says no matter what, he has, yes, his cancer is terminal. So we spent the day together. Mom brought him to my house. We made breakfast. Because when your hands are in there, you'll eat. That's how I learned. And so we made breakfast, we ate. He ate everything. We made dinner, he ate everything. And then when Mom was ready to leave, he says, when am I coming back? So when you see, you cannot be fatigued. You see the result. It's so evident. Yes, it's so evident. You just want to continue to help. But it's also important to take a mental break. If I have a rough day at work, on my way home, no radio, no phone, nothing. Because that's how I reflect that quiet time. On my back door, my back door where I enter and my husband enters, and my doormat says, leave all your issues here. Don't take it inside.
Where did you get that? We need to all get that.
So it's a nice reminder. You're going to leave my issues outside.
Thank you. So the question is, in the face of a problem of evil and death and so much suffering for people who are so young and innocent, children, how do you deal with the problem of the historic problem of pain and suffering in this world?
So as a nurse, as a nurse practitioner who oftentimes is the one present to help with medications, etc., for those children who are in pain, is comfort. And the important thing is that no one suffers. And managing their pain, managing the pain of the parents, explaining to them what's going to happen, what to anticipate. I know it is difficult, but that young life, for each of us who are here, it's a small journey, and our job is to leave those footprints in the sand. And it doesn't matter if that baby is 10 months old or that child is 17 years old, they leave footprints in the sand for their families. They leave footprints, their footprints in the sand. And those are the footprints and the light that that family will use to guide them. I have seen many parents, it's their only child. They tried and tried and tried. And at 2 years old, they lose that child. However, they formed foundations. And those foundations continue to raise funds to do research for cancer. So despite the pain, I would not have come to healthcare if my mom had not died. So sometimes despite the pain, I don't ask why, because the answer isn't there. How can I help? What can I do? What can I learn from this experience to help others, help myself, to grow, and to shine just a little light in this dark world?
Thank you, Paulette. Ellen?
Have we got time? How many of your folks at the end of this journey have got living wills?
When I have a teenager, a young adult who becomes 18, usually we ask them to designate someone who can make decisions for them when they're not able to make decisions on their own. And that is something that we all should do and we all take for granted. In New Jersey, there is a form that you can complete that is good, whether you're at home or in the hospital, wherever, that tells you can say what your goals of care are. And I like to do goals of care with everyone. What's your goal? Some people, I just want to be comfortable. I just don't want to have pain. And so that's how we approach. Polst, yeah, it's called Polst, capital P-O-L-S-T, and that is good wherever you are. You have your designee on there, the phone number, what you want, your goals of care.
Yeah. Paulette, I know you have very challenging work, yet you enter into it with so much joy every day. But how can we pray for you as you continue to do your work so faithfully? How can this community be part of your journey?
Keep me in your prayers every day. Every day. That I have patience, kindness, empathy, and to continue to work with grace. Because that's the most important of all. Yeah.
Well, thank you, Paulette.
Thank you.
And bless you.
Thank you.